Hello and welcome to the fifth podcast on the recently published National Cancer Plan and what that means for us in Wessex. Today we're talking about how the National Cancer Plan addresses inequalities. The plan sets out its stall as being hardwired to narrow health inequalities. That's a big ambition. It's very specific about ambitions from screening to treatment, targeting inequalities of diagnosis, treatment and care, and for those living with and beyond their cancer treatments. I spoke to Emma Leatherbarrow, our strategic lead for inequality and involvement in the Wessex Cancer Alliance, to get her views on how we address the ambitions set out by the plan.
Hi Sally, thank you for inviting me to share my views. Patient experience and inequalities are both reflected in the plan, and it's good to see the focus on quality of life for people living with and beyond cancer. The plan talks a lot about personalising treatment and care, and I think this is key both to improving patient experience and reducing inequalities. We talk with a lot of cancer patients and their families and carers, and they tell us that, of course, effective treatment is important, but understanding what matters to them, supporting them to access services that are closer to home, and giving them good quality information so they can look after themselves all makes a big difference to their experience. There's a lot in the plan around inequalities too, and it sets out the importance of equal access to the best cancer treatment for everyone, regardless of their backgrounds or where they live. There are also sections setting out challenges, particularly for cancer alliances, to ensure they are reaching people who are less likely to know the signs and symptoms of cancer or take up screening, to level the playing field for early diagnosis. In terms of patient experience, it's great to see this as one of the headlines of the plan, alongside faster diagnosis and treatment and improved survival. Often this is a bit of an afterthought or even a nice to have.
Patient experience has and always will be something we're very focused on. Emma, can you explain how we ensure the work we do is actually making a difference for patients?
We do a number of different things to make sure that patient experience is really wired into everything that the Alliance does. I think really central to that is our involvement steering group. This is a group of people with lived experience of cancer themselves, either as a patient or as a carer of someone with cancer, and they come together every 2 months. We give them information about the work that we've been doing to involve patients in our work, but also how we track and manage patient experience. And they really hold us to account for the quality of that work and what we're doing about it. So one of the crucial things around patient experience is that you can ask people what their experience is, but if you don't then listen and do something different as a result of that, you've really kind of wasted their time. And we don't agree with that here at the Alliance. We really think that when people give their time to tell us what their experience has been or to input into our projects, that we really should listen and respond to that. And our involvement steering group help hold us to account to make sure that we are absolutely doing that. So alongside the involvement steering group, we also support lots of individual projects in terms of patient experience. And that will look at how people felt with a specific service. So for example, we've done some work on our rapid investigation service that seeks to find cancers from less specific symptoms more rapidly. And we know that people really like that service. They feel reassured. They feel that it's quite personalised to them and it's easy to access. Another example is a piece of work we did last year around a new pilot service to improve the speed with which men who find lumps in their testicles can get care so they can self-refer. And again, we followed up with a small group of people that had been through that service to find out what their experience was.
And how are we addressing the issue of health inequalities across Wessex?
So in terms of inequalities, we don't do too badly compared to other parts of the UK, but we have still got inequalities in stage of diagnosis and in some outcomes for some groups. And we don't want that to be a situation that continues. We have a number of pieces of work that we do. Probably our biggest one every year is a project called Communities Against Cancer. That works with community groups to provide training and support, including small grants, to help communities talk to people within their own community about cancer. And that project's been going for 5 years now. We know that it raises awareness of cancer. In the last year, we've started finding cancer champions within those communities, and they're a brilliant group of people. So a terrific project, really, really embedded in communities and working with quite a wide range of people across Wessex.
You've spoken about involving people. How do we work with people to shape the projects that we do?
So it's really important that we don't only have the experience of people that have been through pathways, but that when we're creating new services, new pathways into cancer, that we involve people in how they're designed. What we know is that involving people that are going to be using services in the design of that service generally means that they're more accessible and they meet people's needs better. And that applies across lots of different areas of work that we have. And actually, in particular, I wanted to talk about our website, our patient and public facing website, which is called Cancer Matters Wessex. So it's a really good repository of all sorts of information about cancer care. It links off to reliable sources of information, so the NHS website, some of the big cancer charities like Macmillan, CRUK, but it's also got locally specific information from Wessex. We knew the website needed to be upgraded, and actually it was our involvement steering group that pointed this out to us about a year ago, that we really needed to refresh the website. So to make sure that it really met people's needs in terms of the information that they needed to find, we recruited a group of about 8 people with lived experience of cancer. They were absolutely fantastic, and they completely reshaped what we have on the website to make it much, much easier to use, to reflect the way people actually use our Cancer Matters Wessex website. Without their help, it wouldn't be nearly as effective as it is. It was a really rewarding piece of work for us to see effectively patient leadership in something which is, by patients for patients.
So what are we going to do differently or more of as a result of the national plan?
Well, it feels like we've got much of the right building blocks, foundations in place, but we want to go further and faster. Everything we do is more effective if we can work in partnership. So if you're listening and you're from a community group, a local authority, a local business, we would love to work with you. Cancer is tough, and the 10-year plan is rightly ambitious. We're absolutely going to have to collaborate to achieve our goals. So many people survive cancer now, and we know we can improve this further. Really, what we're looking for is to generate a social movement for change, where we speak up about cancer, we increase awareness of how to prevent it, we know the signs and symptoms, and that no one gets left behind. I think it's by working together that we'll make the biggest difference.
Thank you, Emma. Thanks for joining us today. Next time on our 6th podcast, I will be speaking to Dr. Richard Roop about the implications for primary care of the National Cancer Plan. Thanks for listening.